Hi, I'm Dr. Seth Force. I'm the Kamal A. Mansour Professor of Surgery and Chief of the Section of General Thoracic Surgery at Emory University Hospital in Atlanta. So, as we've talked about before, there are various different types of lung resections, or the amount of lung that we need to remove a tumor. Going from the least to the most, we talked about a wedge resection, which would be a simple kind of, snipping off a little bit of lung to remove the tumor, to a segmentectomy, which is removing part of a lobe, to a lobectomy, which is removing the entire lobe. Oftentimes we have to remove more than one lobe, and a very, common variant that would be something called a bilobectomy. And that commonly can be seen when tumors involve the airway to the middle and lower lobes on the right side. So the airway that goes to the middle and lower lobes is a common airway, and sometimes the tumor can involve that airway. So we have to do a bilobectomy, or take out both the middle and lower lobes. And occasionally we have to take out the middle and upper lobe on the right side. But sometimes we might have a very central tumor that is involving, say, the entire artery going to the left lung, or the entire artery going to the right lung, or the main airway going to the right lung, or the main airway going to the left lung. In that case, often the entire lung has to come out. That's called a pneumonectomy. And it's a big operation. That operation typically is done through a thoracotomy, although some people do that minimally invasive. But that's pretty, most surgeons are not doing that. Most surgeons would still prefer to do that through a thoracotomy or a bigger incision and remove the entire lung. It's a significant operation because it's removing a lot of lung capacity. And there's a lot of nuances with not necessarily the operation in the operating room, but deciding who's a candidate for that, because you need to make sure that the patient can tolerate losing that much breathing capacity. And that involves working up and seeing how much breathing capacity they have now. And then there's various techniques to decide how much function that lung that you're going to remove is providing. And you can, mentally subtract that from what the patients have to determine what their post-operative breathing capacity could be. There's two common ways of doing that. One way is you can count up all the segments of the lung and, do the percentages and subtract that from the whole. Or there's also, another X-ray we can do called a perfusion scan, which involves seeing how much blood flow is going to each lung, which is, basically represents effectively the work of that lung, and it's read out as percentages, and you subtract that percent. So, what typically you'll get is a perfusion scan that says, oh, we have 70% perfusion to the right lung and 30% to the left lung. So if you're going to take a left lung out, you're going to remove 30% of your breathing capacity. You can subtract that from what the patient's current breathing capacity is and decide, can they tolerate that operation? Sometimes there's even more complex operations called a sleeve resection. And this may be getting a little too complicated, but if a tumor is involving a part of a main airway, you might need to take the whole lung out, or sometimes you can actually just cut out that part of the airway along with the lobe and then reattach the remainder of the airway back to the main airway of that lung, thereby sparing that lung. So it's almost like if you have a rusty pipe, you can replace the entire length of the pipe, or you can cut that piece out and put another piece of, PVC pipe or plastic pipe in its way and kind of fix that spot. So, it's not always so straightforward. And these are things that need to be discussed with patients, because a pneumonectomy, it's not that it's that much of a riskier operation necessarily in the operating room, but obviously you're really taking the patient's breathing capacity down significantly, and patients have to be prepared for that in terms of effect on their quality of life, and how they function. Although, if worked up adequately, patients can have a completely normal life after a complete lung or a pneumonectomy.